Okay, our next one is going to be rhythmic rotation. So again, rhythmic, and we have the term rotation. We're doing some sort of rotational force. So for rhythmic rotation, the goal of this one is to help decrease spasticity. So we really are just trying to cue our patients to relax. And a lot of times when we have that very gentle rotational force, that's going to cue those muscles to relax to then eventually decrease tone and spasticity. That is our main goal. So we're going to do this in a lower trunk, excuse me, as a lower trunk roll for the lower back glutes. But again, you can do this in any extremity. If I'm doing a passive rhythmic rotation of the arm, maybe I'm just very gently and passively rocking and rotating. Think about rocking your baby asleep, right? It's going to be able to relax them. So for rhythmic rotation in the lower trunk roll, with a lower trunk roll, excuse me, your position is going to be critical. So if there's only one clinician there, usually you're going to want to be at the legs. But when somebody has a lot of tone and spasticity, when they move their hips, you might see their whole body and their arms kind of move with them, right? If they're really, really tight. Versus what should happen, if I would have Sabrina do a lower trunk roll, her legs should turn to the side, and then sometimes maybe even she'll get a little bit of a rotation of her chest in the opposite direction. So if somebody's very, very spastic and has a lot of tone, you might also need another clinician to be at the shoulders, stabilizing the shoulders there as well. But we're going to say Sabrina just has tone and spasticity throughout just her lumbar spine, lower back. So I am going to stabilize the feet. I'm going to cue her relax and just let me move your legs. And we're just nice and gently, we're going to bring the legs here to the side. I want you to feel just a very gentle pull, and then we're coming back. Now, we're not necessarily holding this position. It's not that we want a stretch per se. We're just trying to relax and decrease some of the tone. And usually this feels really, 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 really good for a patient. You probably will have to constantly remind them to relax. You might feel some of that tone, which gives you an indicator to cue them to relax there as well. So we're just going to go back and forth. I'm going to do one more. All right, good. Very good. And that is rhythmic rotation.